I'm Dr. David Beaulieu with more news you can use. I want to talk to you today about Alzheimer's. I want to talk to you about dementia in general. I want to talk to you about neuroses and psychoses. I want to talk to you about anxiety. I want to talk to you about depression. I want to talk to you about problems with the human brain disease in all kinds. I want to talk to you about epilepsy. I especially want to talk to you about epilepsy. We're told that we really don't know what to do for most of these conditions. We have drugs that interrupt enzyme patterns and tend to create symptom relief for some people. Certainly not everyone. Maybe just barely a majority. Some of the research says that the results are not much better than a placebo, which is 30-35%. That's not saying a whole lot. And we're told that there's not much else we can do. And it's not true. There is a diet. There's a great diet. It's a great brain diet. Now, on top of that, it's also the diet recommended in the most recent research for cancer. But it's a diet specifically designed over 2 decades ago by a Dr. Freeman and a Dr. Kossoff from Johns Hopkins University Medical School. Now, we're right up there with Harvard and Stanford when we start talking about Johns Hopkins, and it's called the Ketogenic Diet. And they built this diet to control childhood epilepsy. And we've got kids who have epileptic seizures 3-4 times a day, and they go on this diet. It stabilizes brain function, and they stop having seizures. It works for children. It works for adults. Now, the brain is a complicated organ. The brain is mostly protein and fat, and the fat content of the brain is somewhere between 60 and 65%. If you're on a low-fat diet, you're asking for problems with your brain because the body gets a new brain about every 24 months in the adult state. So it's constantly turning itself over. It's repairing. It's using genuine replacement parts. If you're not getting the adequate fat, you end up with something less than what you had before. If you've been on a low-fat diet for 10 years, you've gotten a new brain 5 times. And if every time you've got that new brain, it's a little bit less than it was before, you got some serious problems coming on. Now, thank goodness our organs have tremendous organ reserve. You can lose a lot of brain function without hardly noticing it. But 5 times, you're going to notice that. This is a phenomenal diet. It's really high in fat and protein, very, very low in carbohydrate, and virtually non-existent in simple carbohydrate. If it will control the seizure of a brain, if it will control an epileptic seizure, it's building a healthy brain. If you have someone in your family with dementia, if there's a history of Alzheimer's, if there's anxiety and or depression, and you need to treat brain function, that's the book.